So I'm going to talk to you a little bit about what we're doing in California. What we're doing is a little bit different in that we're not housed in an academic research institution. Just in terms of disclosures, we do receive funding from GlaxoSmithKline, as well as we have an independent educational grant from Merck. So back to the CMA Foundation. We are a nonprofit with California Medical Association Foundation, a nonprofit arm connected to the California Medical Association. We conduct a number of public health related projects with the main goal of trying to connect physicians with community. So for us, since obviously the state of California is rather large, we tried to think of a way to kind of hone in and really address our cervical cancer prevention efforts, focusing on the issue of health disparities. So we wanted to look at, which populations in our state are really being most affected by cervical cancer and where, and kind of hone in on that area. So in California, Latinas actually have the highest mortality rate from cervical cancer, so we knew we wanted to work with Latinas, and then we also looked at it kind of by county and decided to focus on Los Angeles. So that's where part of our project is, and then we also have a second component that looks at more statewide issues, so I'll just highlight a few of those. So in terms of our work in Los Angeles, kind of similar to what Teresa said, we really did want to kind of go to the community and figure out, what's happening there before we really were to get started. So we conducted 3 different roundtable discussions on cervical cancer prevention. The first was in December, and we brought together community-based organizations, public health representatives, as well as ethnic media, Latino ethnic media. So the idea was to try and get a lay of the land and figure out what resources Los Angeles has, kind of what's already going on in terms of cervical cancer prevention, and help communicate that with different Latino ethnic media outlets, and also provide the 2 groups to kind of have an opportunity to converse about the subject and really talk about story ideas that could be put out there through ethnic media, and with the focus being about January being Cervical Cancer Health Awareness Month. So we had that meeting in December. I know we don't have time here, but if you go to our website, we do have a video that kind of highlights a few interviews with people that attended to give you a sense of kind of how that meeting went down. Also, all the meeting agendas and minutes and things are online. So we followed up that December meeting with 2 meetings in March. One of our big lessons learned was we didn't get a lot of healthcare professionals to attend the meeting in December because we had it during the day. So we set up a meeting in the evening and brought together mostly healthcare providers, mostly physicians, as well as a few nurse practitioners. And again, ethnic media. We brought ethnic media to the table to have a similar conversation, but figure out what are healthcare providers experiencing in Los Angeles as it relates to cervical cancer prevention. And then we had a second follow-up with the group that came in December to talk about how January went, what kind of news articles were put out about cervical cancer prevention, and kind of how we can move forward and continue to keep it in the media. So I mentioned that ethnic media was at all of those events, and our big partner to do that was New America Media. And they are kind of a collaborative and advocate for ethnic media organizations throughout the country. And this is actually the fastest growing sector of American journalism. So for us, this is kind of a really unique opportunity and a way to find kind of a trusted source to get out some of this information to our target population. So we worked with New American Media to identify a number of ethnic media fellows. We provided them a small stipend to do research on cervical cancer prevention stories and put that out there through their mediums. So our next steps, kind of as it relates to that ethnic media component, we're working with a Robert Wood Johnson Foundation Clinical Scholars Fellow at UCLA, who's very interested in this subject. And she's going to be doing her community project, looking at basically how to incorporate health messages into Latino ethnic media stories. So she's going to be interviewing them and figuring out kind of what their process is for putting together stories, what they need from health organizations that we all might represent, how we can all better work together. They're a great way to get kind of media attention around some of these issues. It's very low cost for public health programs, which we all don't have a lot of money. So it's a good outlet. So we're looking to learn more about that and hopefully put together a toolkit or some sort of tip sheet that healthcare organizations can use when working with ethnic media, kind of as a way to figure out what works, how you need to get them invested in the issue that we want them to share with their community. And we're also going to do a second round of ethnic media fellows. It's kind of underway right now. We're getting started identifying the fellows, and we have identified one who wants to put together Spanish language television PSAs on the subject. He used to work for, and I can't remember if it was Telemundo or Univision, but he used to work there, so he has a lot of connections. So we're hoping that we can get some airtime on that PSA. We're also working with New American Media to put together advertorials. So with the ethnic media fellow articles, we don't always have a lot of control over the content of the story. So sometimes they turn out really well, and sometimes there's some facts and things we wish we could have tweaked or added in there a little bit. So the advertorials are pieces that we can create and place in some of those media outlets and kind of make sure that the message that we want out there is kind of getting there. So that's on board to come out this summer. And then we're also, through our healthcare provider roundtable, we identified a lot of really interesting best practices. So we want to kind of highlight what's happening sort of in that healthcare provider realm in Los Angeles and hopefully translate that and send it out to others throughout the state. So our statewide call to action, November 4th, we had a summit similar to this to kind of launch California's cervical cancer-free campaign. We also have a number of project communications. We've updated our website. We have an e-newsletter. We also did a statewide HPV vaccine healthcare provider survey to try and learn a little bit more about providers' beliefs about the HPV vaccine, some of the barriers they're experiencing. So we're analyzing those results right now. Let's see. And then for January, for Cervical Health Awareness Month, we also did a statewide kind of media blitz, put out press releases, tried to get some attention around the issue. And a number of those articles and things that I mentioned with the Ethnic Media Fellows and also statewide stories that came out for Cervical Health Awareness Month are all on our website. So just really quick, some of our next steps. In California, we now have a Tdap mandate for 7th through 12th grade students. So this upcoming school year, all students they can't walk in the door without the pertussis booster. So we're using this as an opportunity to really promote the whole adolescent vaccine platform. So that's something big we're working on. And then we're also trying to put together a Champions for Health project. So we're looking to identify healthcare providers that can serve as champions around this issue, educate their peers, educate their community, serve as media spokespeople. We're always looking, for those folks. So we thought we'd go ahead and train some and have some as part of our team. And that's it. Feel free to contact me for more information. I'm happy to share it. Thanks.